Some people are still on the fence about getting the COVID-19 vaccine. There are still conspiracy theories and rumors circulating everywhere, which is why we have an expert who will go over the latest updates on COVID vaccines and answer your questions next on Dr. Q&A. Welcome everyone to Dr. Q&A. I'm Olga Villaverde, and joining me today is Dr. Lorraine Dowdy. She's an infectious disease specialist at Midway Specialty Care Center in South Miami, Florida. Thank you so much for joining us, Doctor.
Thank you so much for having me.
Doctor, before we get started, and we have many questions, I just want our viewers to know that if you do have a question that you'd like to send in, please do. You can give us a call, 855-796-4475. You can also email us questions at allhealthtv.com. We'll even allow you to get your cell phone and upload your question, a video on our website, allhealthtv.com. Lots of ways to do so. So, Doctor, let's get started. Lots of questions, like I said, and I want to start with this video question from Mariana. Let's take a listen.
Hi, my name is Mariana, and my question is, if I were to get the vaccine, what is the likelihood that I could contract the virus compared to the likelihood that I would get corona without the vaccine?
That's a very good question that I hear a lot too. Thank you, Mariana. Doctor?
That is a very good question, and people have those concerns. Let me just say this, that coronavirus is something that no human beings had immunity to prior to the onset of this pandemic. So your chances of getting COVID-19 if you were exposed are actually very high. If you're vaccinated, the COVID vaccines that are currently on the market, the Moderna and the Pfizer vaccines, are approximately 95% effective. That means that if you are exposed to coronavirus, you have less than a 5% chance of actually becoming ill. And that's the main thing. These vaccines prevent you from becoming ill, and they also prevent you from being seriously ill, where you would end up in the hospital requiring a machine to help you breathe. So the chances of getting COVID-19 without vaccination are actually very high if you've not had it already. And the chances of getting COVID disease and being sick enough to be hospitalized or on a machine are actually 5% or less for the two main vaccines, and also for the Johnson & Johnson, still less than about 15%.
And that's why we hear a lot of people saying that if I haven't gotten it already, why should I even bother getting the vaccine right now? It doesn't mean you won't get it.
No, it doesn't mean you won't get it. It means that you may not have been exposed yet. And the more people that are vaccinated, the less likely you are to be exposed. So certainly I would recommend that everyone consider getting the vaccine under the circumstances. We know that there are certain risk factors for getting severe illness, being diabetic, having heart disease, kidney trouble, under treatment for cancer or chemotherapy or other things. So it's worthwhile getting the vaccine. And even if you don't have any of those health risks, it's important that you protect people around you who may be vulnerable and may have other reasons that they cannot be vaccinated. So again, it's not just for you, but it's for your community, it's for your abuelos, the abuelas, the people around you who may be sick, little kids who are not yet able to get the vaccine. That's another compelling reason to get vaccinated, even if you think, I'm healthy, I don't need to have it.
What if someone says, well, Mariana is young, obviously she looks like she's in her teens. Why should she get vaccinated then? Is it to protect others? Is it to protect herself? Because they say the young teenagers, have I guess, more immunity, if you will.
They actually don't have more immunity. What happens is that they are less likely to become seriously ill if they are infected. However, we do know that there are serious consequences, even for young people. Some people end up having what they call long-haul COVID symptoms, where they become short of breath, or they have other kind of neurologic symptoms, brain fogginess that persists long after even a mild COVID infection. So for people, especially for young people like Mariana, I would say, think about your parents, think about your grandparents, little kids around you who may not be able to get vaccinated. You're doing it for them. Even if you think, oh, I'm healthy, my chances of winding up in the hospital are actually small.
And I'm glad we talked about that because even my girls, 17 and 19, they were a bit adamant about getting it. And I had to force the hand, if you will. And they weren't very happy with me, but the job got done, if you know what I mean.
I do know what you mean. All my children are vaccinated, including my 19-year-old. So it's definitely worth it.
Speaking of vaccinations, doctor, I want to show a quick video to our viewers from the CDC on why we should all get vaccinated. Take a look.
I got my COVID-19 vaccination, and here's why. This isn't about gimmicks or sentiment or what commercial I like. This is about facts. COVID-19 vaccines are safe and effective. Millions of doses have already been given in the United States, and these vaccines have the most intensive safety monitoring in U.S. history. When you need more information, use a reliable source like the CDC website.
And that's why we do these shows, reliable sources to get the facts out there, doctor. We're going to talk about safety in a little bit, but I want to get to a question from and I'm so sorry if I say your name incorrectly, but Lorraine, I think that's how I say it. And here's the question. What about the magnet sticking to the arm of COVID vaccinated people? I think this is like a new conspiracy theory, doctor. Can we kind of debunk this?
Well, we can definitely debunk it. So you're correct. And the reason I understand that people are concerned about vaccination, it seems like all of this has happened on fast forward, and that is true. We are in a pandemic. This is something that the world hasn't seen for about 100 years. But let me say this. The average person has less than a tenth of an ounce of iron in their body. So the idea that they can be magnetized by something external just is not physiologically possible. This is not something that human beings can be magnetized. Even a bar of iron, it would be very difficult to magnetize. And if people could be magnetized, they wouldn't be able to get an MRI because an MRI works with a giant magnet. So I'm
right.
not sure where this conspiracy theory came from, but like I said, iron in the human body is a minor mineral. We do need it. We need it to make blood effectively. We need it to carry oxygen effectively, but it is not enough, or certainly it's not feasible in any way realistically that people can be magnetized, especially by a vaccine that doesn't have anything to do with magnetism whatsoever. So I hope that helps, Larissa.
Oh, it does. As we
the vaccine.
Yes. As we say in Spanish, punto y aparte. In other words, let's move on from that one. Doctor, I have a couple of questions, and these I've heard a lot, and I always think it's important to reiterate a couple that seem to just continue. I've tested positive for COVID-19. Why should I get the vaccine? And then the second one is, are the vaccines interchangeable? So if I get the Pfizer shot the first time, can I then get the Moderna and vice versa? Can you take those two questions for me, doctor?
Okay, sure. So let me take the first one. If I've had COVID, should I get the vaccine? Should I even bother? Well, it goes back to, I think, the first questioner, Mariana, asking about getting the vaccine as a young person. So we do know that many young people have mild illness when they contract COVID-19 virus. So they may have a very limited illness. They may not feel very well, just tired for a couple of days, and actually recover quite well. The problem with that is that your body may not make a sufficient response in that setting to protect you from a second exposure. And even if it does, it may be that immunity, that immune response, or that your defenses for COVID-19 are not high enough to prevent getting infected in the future. So we do recommend that people get vaccinated if they've had COVID-19, especially if they've not been sick enough to be in the hospital. And that time frame is about 90 days from the last symptoms. So we do recommend that people get vaccine even if they've had COVID-19. And regarding the second question of whether or not you can receive one vaccine and then the other, there really isn't any. There's no data so far. There's a new trial that just started in China, where they're looking at two different vaccines, not the ones that are approved for use in the West or in the United States, but two vaccines that are being developed in China. to look at sequential vaccination, meaning that you get one vaccine the first time around and then a different kind of vaccine the second time around. There are some considerations that people who have had underlying cancer therapy or who are on medications to stop transplant rejection may not mount enough of a response with either Pfizer or Moderna in the beginning, and that maybe a third dose with a secondary vaccine, either the Johnson & Johnson or AstraZeneca, might boost more of a response. So I think we'll have answers to that, probably not in the near future, but I would believe by the end of the year we'll certainly have some data to give us more clarity in that setting. So for right now, we're recommending if you start with Pfizer, get your second Pfizer shot. If you started with Moderna, get your second Moderna shot. And if you got the Johnson & Johnson, well, that's the one and done.
Fantastic. Thank you, Doctor. We have a question from Peter, and he emailed us. And here's his question. I'm concerned about getting the COVID-19 vaccine because they were developed so quickly. How do we know that COVID-19 vaccines are really safe? That's a question that I've heard as well, Doctor. What would you say to Peter?
I've had that question actually from my own patients that I recommend getting vaccinated. So let me just say this. I know it seems fast, but in reality, in 2003, there was an outbreak of a very similar virus. Didn't act exactly the same way, but in the same family, a coronavirus. Some people who are old enough might remember the SARS epidemic. So right around that time, there was a big push to develop vaccines. And shortly on the heels of SARS, there was an H1N1 influenza outbreak, which was epidemic but didn't become a pandemic, meaning that it didn't affect the entire world in the same way. But we in infectious diseases have been worried about these kinds of emerging viruses for a long time, and the fact that our vaccine technology was so old that it wasn't agile enough. It wasn't able to respond in a rapid way to new emerging diseases. And so with that in mind, a lot of money and effort went into developing new platforms, new vaccine kinds of technologies. And that's where the two Pfizer and Moderna vaccine comes in, mRNA. And actually mRNA technology goes back even further. It goes back to the 1980s, early 1980s, where people were looking at vaccines as a way of treating cancer. So even though it seems that it came quickly, we do know that this has been building over time. During the George W. Bush administration, he famously read a book, talk about scary summer reading on the influenza pandemic, the 1918 pandemic, and realized that the United States didn't really have a concerted plan to deal with a rapidly emerging infection. And so he actually set Health and Human Services to look at developing a pandemic plan that was built upon by the succeeding administration, the Obama administration, and then subsequently the Trump administration went full bore with Operation Warp Speed, which basically put a lot of money very quickly into helping all the companies that had been doing vaccine research to bring the products that they have been working on in terms of new platforms to bear on COVID-19. So it seems fast, but in fact, all the pieces were there. It's kind of like having a Lego set and knowing what the picture should look like. And then all of a sudden having everything that you can just put it together very quickly and not go searching around for pieces.
Fantastic analogy. Thank you for that, Doctor. I have a question that just came in from Denise, and let me read it to you, Doctor. I just saw on the news that 2 people on a cruise ship have COVID-19. Are we going to see a rise in infections across the country since people are now traveling? That's a concern. I can see why she's asking that. What would you say to Denise?
I would say yes, that is a concern, and that's a concern for all of us in healthcare. Yeah, I saw that, and actually that was a cruise ship that required all the workers on the ship to be vaccinated. You know, we are doing relatively well in Florida. More than 50% of Floridians have received at least 1 dose of COVID-19 vaccine. And or over 65 actually are more than 60%, 65%. So we're doing relatively well. But if you go just along the Gulf Coast to Mississippi and Alabama, they're struggling. They have, 10% of their population vaccinated. So as people start to move around, we're going to see outbreaks. We're going to see spikes in cases. And funny you should mention that. There was last weekend there was a Bitcoin uh, convention where I think 12,000 people came into Wynwood area in Florida, and already there seem to have been cases associated with that since no masks were required and no vaccines were required. So we will see spikes, and this is why I think it is still prudent for people to wear masks, especially if you're going to be in close quarters, and why it's so important that everybody gets vaccinated. I think the more people are vaccinated, the less likely we are to see these kinds of outbreaks, especially close quarters like on cruise ships and in conventions.
And let me ask you something, doctor, because in some areas you're required to show that you've been vaccinated. And yet we've heard also, maybe not many cases, and you can correct me if I'm wrong, but those that have received the vaccine but yet still got COVID after. I think they're called breakthrough cases. Can you talk a little bit about that and why it happens?
Okay, so that is a thing, breakthrough cases. The CDC has identified, I think, close to 8,000 breakthrough cases at this point. And remember, these vaccines are not 100%, right? They are 100% in terms of being effective at preventing hospitalization and death. They are not 100% effective against preventing disease. So 5% of people who get either Moderna or Pfizer still may contract COVID-19. So the idea is that if they do get it, they will not be very sick and will not need to be in the hospital and will not need to be on a ventilator to help support their breathing. It's a little bit, the numbers are slightly higher, but again, the reason that we vaccinate people is to prevent illness and death as well as transmission. So it doesn't prevent, and there are these breakthrough cases, and we'll know more with these, whether or not some of the new variants that have been popping up in various parts of the world are going to present more of a problem with breakthrough, and we just don't know that yet.
Okay, thank you, doctor, very much. We have a video question from Olivia. Let's see what they have to say.
Hi, my name is Olivia Prokilo, and I have a question regarding the COVID vaccine. Does the COVID vaccine affect pregnancies in the future? And are you able to get the vaccine while pregnant?
I am so
Great
glad Olivia
question.
asked that question. Oh my
Thank you,
gosh.
Olivia.
After my children got the vaccine, all they kept on saying to me was, great, there goes my fertility. And I went, no. Could you talk
You're
about that,
correct.
doctor?
You're correct. So let me start with the vaccine before considering pregnancy. All of these vaccines go through a stepwise investigation, or what we call clinical trials. And in clinical trials, there's a phase 1, which is basically, is the vaccine safe and is it effective? So we go through safety first. And in safety, a lot of people receive vaccine. I think 40,000 people in the Pfizer trials and another 40,000 people in the Moderna trials received the vaccine. Some of these obviously were women, and many of these women became pregnant during the course of being monitored after receiving the vaccine in the trials. And they've been followed very closely over this period of time. None of them became ill, and their pregnancies were fine. So we do know that even in a small, relatively small trial of 40,000 people, there were pregnancies, even though they were not intending to study pregnant women in those trials. So that's the first thing. Secondly, the FDA and the CDC follow these cases very closely, and we have a lot of data now on pregnancy and what happens in pregnancy. There are about 95,000 women have been followed during the last year of the pandemic through various stages of pregnancy. What we do know is that 160 of those women lost their pregnancy. And the rest, a small number, about 400 of those women were sick enough to be hospitalized, and a smaller subset in the ICU. We do know that it has consequences for the pregnancy in that the mom may be very sick, as it happens with other viruses, including influenza, that a mom who is pregnant who gets one of these viruses has a higher risk of complications. And we do know also that
Mhm.
some of these babies ended up in neonatal intensive care units. So on the one hand, the vaccine, even though it wasn't intentionally studied in pregnant women did become pregnant while they were in the vaccine trials. And we do know that after the vaccine trials, women who had COVID, not vaccinated, there are risks to mom and baby. So I hope that answers Olivia's question.
It does. Thank you so much, Doctor. We have about 5 minutes left, and I want to get a couple more questions in. This one just came in from Ross. And again, I've heard this one as well. Can the doctor speak to the people who claim that an mRNA vaccine will inject foreign DNA into their body? Doctor?
Yeah, I've heard that a lot myself. So I think, unfortunately, it's hard to explain stuff to people who don't understand kind of some basic genetic code. So the mRNA, the M in the mRNA stands for messenger, and that is a kind of protein that gives instructions to cells. So the idea that it's going to change your DNA in any way, it just is impossible. What the mRNA does is that it gives instructions to your cells that make protective proteins that are called antibodies, right? So it takes the instructions for the protein against the spike, which is the little part of the surface of the COVID virus that allows it to get into cells. And it just tells your body, hey, you need to make antibodies, you need to make proteins to fight against this. So it disappears from your body once it gives the signal to your cells to make those proteins. So it cannot change your DNA. It doesn't even change your RNA. It's just a little message to your immune system to say, hey, we need these antibodies. Go ahead and make some in case we ever see this virus.
Doctor, another question that I think is important coming in. Who will monitor vaccine safety long term in terms of just like 5 or 10 years from now?
Well, actually, there's a very robust mechanism for looking at vaccine safety, and it's called the Vaccine Adverse Events Registry. Anyone can go online, you can look it up. If you've had a vaccine and you think that you've had some kind of bad effect, you can actually go and report it, and all of this is kept in a database. And what happens is, as these reports come in, as these possible adverse events are registered, they're compiled, and we go back and we look at them and see, is this really something that can be attributed to the vaccine, or is this something that is coincidental? And a great example of this, and to give people the comfort level that all of this is being monitored very carefully to see, are there any adverse events that would outweigh the benefit of the COVID vaccines as opposed to the risk of getting COVID and being sick and possibly dying. So people may have heard of the blood clots associated with the Johnson & Johnson vaccine and the AstraZeneca vaccine. These things became known because we are following what happens to people who are vaccinated. And so we are able to look at these and to, again, reevaluate step by step, is this now too much of a risk compared to the benefit, which is not getting COVID-19 at all. The FDA is going to be looking now at a couple of cases. It started out maybe 7 cases. Now there are 226 cases of an inflammation of the heart in young people, in adolescents who received the vaccines. And they're going to be looking at that to see, is this something that may make them change the recommendations for that age group? So I just want people to know that these things are not being unleashed on the public with nobody watching. The reason that we do know that there are side effects is because we are watching. And if things change, then the recommendations will change based on what the actual science and the data show.
All right, doctor, I got less than 2 minutes and I want to get this one in. Are there COVID-19 clinical trials underway researching if fully vaccinated adults will need a booster shot to counter reduced immunity and a virus that is mutating? Your thoughts on that, doctor?
Well, the answer to that is yes. There are ongoing studies. Remember that the first COVID-19 vaccine that was approved for use, emergency use authorization, was Pfizer back in December. So we do know that at least 6-month efficacy is meaning that the vaccine effect lasts for at least 6 months. As we go along, we will be following all these people out to determine if at some point a booster may be needed. At this point, the thinking is probably maybe at a year, that may be the case, but we don't know. But again, those are things that, you know, the whole pandemic has been flying a plane while building it. So we are learning as we go along, and the more people are vaccinated and the longer we follow people. We're now 6 months out from the emergency use authorization and widespread use of these vaccines. But remember that the original clinical trials started back in April of last year. So by December, we knew that those people who had been in the early clinical trials still had immunity. So now, you know, coming up, we'll have a year's data on those people, and then going forward, we'll have 6-month data on the people who started receiving vaccine at the beginning of 2021. So we will know, and it may be that we will need a booster. We just won't know yet.
Flying a plane while building it. That is a soundbite I will never forget. What a year it's been. Doctor, thank you so much.
Thank you, and thank you so much for having me. And everyone get vaccinated.
Done. Thank you, Doctor. Be safe, and we hope to see you next time. Thank you so much for joining us on Dr. Q&A. Like you heard, get vaccinated, be safe, and we'll see you next time right here on Dr. Q&A. Take care.
The Health Channel wants you to have all the answers you need to be in control of your health.
Infection and the virus keeps coming back.
That's why, in addition to Dr. Q&A,
If treated appropriately, the patient should...
you can always chat with one of our health advisors through our free service, Ask Hannah. Just go to allhealthtv.com or download the Health Channel app and get the answers you need.
No question should ever be left unanswered. Remember, if you don't know where to start, ask Hannah.